Dr. Mondragon here at the Hope Clinic. I'm an internal medicine specialist, a specialist for adults. And I'm here to talk to you about colorectal cancer, colon cancer, cancer of the large intestine. And why is this important? Colon cancer is the #2 cause of cancer death among men and women combined. And the sad thing about this is colon cancer is largely preventable with proper screening. Colon cancer has modifiable, meaning risk factors that you can, modifiable meaning things that you can do to change. There are non-modifiable risk factors. Let's talk about those first. Age. Your risk goes up as you get older. Race, African Americans, for instance, have higher risk. If you have certain genetic diseases such as polyposis, hyperpolyposis, where you basically have hundreds, perhaps thousands of polyps and have to be scoped many times, and sometimes simply have to have parts of your intestines removed because of the number of polyps that you have. Then if you have certain types of diseases, inflammatory bowel disease such as Crohn's or ulcerative colitis, the longer you have these diseases and the more extensive this disease, the higher your risk of developing colorectal cancer. And likewise, if you have family members, especially first-degree relatives, that means a mother, father, sister, brother, that have colon cancer, that increases your risk of having colon cancer. You can't change those things. Those are non-modifiable risk factors. However, there are modifiable risk factors that you can change. And those risk factors include obesity, diabetes, lack of exercise or inactivity, increased alcohol or excessive alcohol intake, lack of exercise, I've already mentioned, low fiber diet. I'm frequently asking my patients, do you eat your vegetables? Do you eat lots of vegetables? So a diet rich in fresh vegetables and fruits is very important for the health of your colon. And cigarette smoking. These are all modifiable risk factors, meaning you can modify your risk. You can change your risk of having or developing rather colon cancer by eliminating those risk factors. One of the things about colon cancer and it being a preventable disease is over 50% of the individuals that are diagnosed with colorectal cancer in the U.S. present as stage 3 and stage 4. And this disease, as I mentioned, is largely preventable. Screening can be done different ways. Screening can be done invasively through a colonoscopy, where the gastroenterologist basically looks into the colon. This has the advantage, one, by direct visualization. If they see a polyp, it can be removed at the time. Secondly, that generally speaking, once a colonoscopy is done, that colonoscopy does not have to be repeated for 10 years. Or it can be done non-invasively, frequently with tests such as a stool guaiac testing or a fecal immunochemical test, where using stool and then with a chemical testing, they look at that stool and determine is their blood, the fecal immunochemical, you can see I'm having trouble with that, saying that, a fecal immunochemical test is better because it's a much better test for the human blood and doesn't have some of the complications that guaiac testing, as it's commonly called, with the stool cards has. But this looks for what we call occult blood, meaning blood that's not visible to the eye, but that you're bleeding from the GI tract someplace that could indicate that you have colon cancer or have polyps that would be the precursors to colon cancer. And so this screening should be done on an annual basis. And so we here at the Hope Clinic would hope that you, when you come to see us, would talk about your need for colon cancer screening. Generally speaking, this is for individuals who are over age 50 up to the age of 75. And then whether or not you undergo screening is determined by what your overall health status is as to whether or not you should continue to undergo colon cancer screening beyond age 75. So colon cancer screening, colorectal cancer, number 2 cause of cancer death in combined men and women in the U.S., largely preventable, multiple modifiable risk factors that you can influence, and is good screening tests available to help early detection so you can prevent this deadly disease. This is Dr. Mondragon, signing out.